Hey, this is Glenn. Welcome to another episode of Difficult Questions. This one, what elective medical interventions are right? And even with that, what are elective medical interventions and what are necessary medical interventions? I was talking to a guy that has Parkinson's, and I was asking about what end of life looks like. And he said, basically, the muscles just stop working and people are no longer able to breathe. And I remember my mother dying of cancer, and what palliative care meant was doping her up with morphine so she didn't feel or wasn't aware that she was drowning in her own fluids. And we got to listen to that as family members. Brutal. So it got me thinking about medical interventions and the process of increasing medical interventions throughout time. And which ones are good, which ones are bad, which ones are elective, which ones are necessary, and why. What I found is there's a breakdown between how much it's going to cost someone, at how much risk, and what the benefits might be to not only the person, but society. So take me for an example. I get hit by a car. I'm in my early 30s. I break my leg and my hip. Arguably, those aren't elective medical interventions to fix me. They are arguable to how good the medical interventions can be to get me working at full potential. And since I was young, the doctors saw, let's try and get this guy back to full potential. But as you get older, doctors start thinking, is it worth putting the risk in to rebuilding this guy completely? How much money do we put into this guy? And, that happened with my father. He had what's called a meningioma growing on his brain. And the older he got, the more risk there was at not having a successful surgery, not having him be able to recover from that surgery or to die on the surgery table. And no surgeon wants that PR scandal or wants that liability, wants that possible bad press, right? Surgeons want to succeed. They're very competitive people. It's a very difficult job. They need to be on the cutting edge and they need to be good at it and they need to prove people they're good at it. Failure is not a good thing for them. It's a bad look. So they always are looking at what the success is for not only the person, but for the people surrounding the people. The guy that had Parkinson's was also an advocate for trans kids' rights. I am not necessarily an advocate for trans kids' rights. I think that when kids are growing, we'd never really know what's going on chemically with any human. We're doing our best guess. Science is improving all the time, but we're all just making educated guesses. And with kids, that's rough. So drugging kids, whether that's hormone therapy or whether that's even behavioral corrective therapy, so Ritalin and things like that, I have a real hard time making decisions for someone that can't make their own as an adult, legally can't make their own as an adult. We know child development. When I was a kid, I had a lot of questions. I did not know who I was. That's part of growing up. You start chemically messing with kids, you don't know what you're going to get. And I know some people think that's not elective. It's necessary. But is it? What is the outcome? We put the kid on Ritalin so we can manage them in a large classroom. Is that good? Is that good for the kid? It's good for the people around them because they're not bouncing off the walls, but I don't know if that's good for the kid. And so in those instances, I think it really takes care of the parent, the person, and the physician. And even if we're talking about adults, it's the person and the physician. And the physician is being asked to do the thing. So I think they get to have a decision in it. But we also live in a capitalist society. So there's always this question of, well, is the physician doing it because it's right? Are they doing it to make money? Are they doing it for political pressure? All of these things come into play. And I think that unraveling all that can be difficult. So ultimately, a physician with an adult or a physician with a parent need to be able to make that decision and then just live with the consequences. I've been listening to some interviews with some trans kids who got hormone therapy when they were 13 or 14 because they needed it, they wanted it, and now they're regretting it. It messed them up as adults. Yeah. People talk about the need for vaccines, right? And the good and the bad for vaccines. Sometimes people making the vaccines mess up. I mean, people have died with bad batches of vaccines before. You got to make the decision. You got to do it. So, but I don't know what is right. And I think we all kind of battle that. One of the things that I noticed is if it'll help someone live, we do it. But if it helps someone die, like assisted suicide, nah, that's not good. We don't need to do that. We'll just let them ride it out. We'll just drug them up on morphine so they don't know how much pain they're in and just let their body process death naturally. I don't know how humane that is. I've watched it happen. It was not humane to me. I just thought, oh, this is brutal. And it's not humane to the people that have to watch it. So I don't know. These are all very difficult questions. I mean, what interaction is right? What is elective? One of the big stories when I was growing up was my grandfather had to save up his own money as a kid to buy glasses because he needed reading glasses. And that was kind of a very American story of pride, self-sufficiency. Parents can't even pay for the intervention for the glasses. So the kid has to go to work and he makes a deal with the optometrist, and I'll pay you back if you give me the glasses first, and then I can work and then I can pay it back. And he made that deal at 10 or 11 or 12. And that's a very American story. But I mean, glasses, yes, I would consider it's a modern necessary intervention. But before we had the technology, it wasn't necessary. People just figured it out. People just died. I look at all these diet drugs. I was listening to a physician saying that it's going to be easier for people to watch their weight in the Western society because of drugs. And I just think, yeah, you need to get up and move. I know that your job has you at a desk. I know that your work and your family is distracting you from exercising and you don't like exercising. My mother was a proponent of, can't I just take a pill? But I think that messes people up. We've seen so many diet drugs on the back end of the fad and what that has done to people. Pain management, doctors getting people hooked on pain medication because people were in pain. When I've been hit by cars, I take what I need to be able to think straight. But for me, and I'm a zealot, pain is just a reminder that you're alive. And I embrace the pain. But not all people want to embrace the pain. And some people like the feeling of drugs. We have the official lab coat drugs, the ones made by pharmaceutical companies. And we consider those legal and good, even if they are overprescribed. But then we see the experimental drugs, the psilocybin and the LSD. and the marijuana, and we think, oh, that's the bad stuff. And it's all these social judgments. But if it works, if it helps someone with their anxiety, maybe it's good. If it helps someone with their depression, maybe it's good. Is it necessary? Which one is necessary? Do we just want the lab drugs, or do we want the natural drugs? But are the natural drugs the hippie drugs, the ones that are also used for non-medical purposes, for entertainment purposes? I don't know. I'm a zealot. I'm a complete teetotaler. I don't use drugs. I try not to use drugs. The only interventions I've had were ones really due to either surgery, appendicitis, getting hit by cars, blood clots, things that I guess you could argue, well, this guy is he needs this. But I have friends with cancer, and I think, how many treatments are you going to go through? And that's their choice. But apparently it's not their choice. They also have a doctor that just at some point says, well, it's not going to work. You got 6 months left. And then they're just supposed to ride that out, because they can't, only in a few states and a few countries, they're allowed to decide when they're going to kill themselves with other drugs that we make. And it's just this constant fight. So I wonder, for you, what is elective medical treatment? What is allowed and why? I don't have the answer. Thanks.